have with us Dr. Soumen Devidutta, consultant cardiologist and electrophysiologist at Apollo Hospital, Jubilee Hills, Hyderabad. Dr. Soumen Devidutta is consultant cardiologist and electrophysiologist at Hospital in Hyderabad and Bhubaneswar. Dr. Soumen Devidutta is having an experience of over 9 years. His special interests include electrophysiology and RF ablation for simple and complex cardiac arrhythmias, coronary interventions, primary angioplasty for AMI, valve interventions, implantation and follow-up of CIEDS pacemakers. Welcome doctor to our Facebook live session.
Thank you, Jasmine.
So starting with our questions, so doctor, could you please tell our audience what is cardiac arrhythmia and electrophysiology?
First of all, great good afternoon, warm regards to all our viewers. Thanks for the platform and for this opportunity. Yeah, coming to the question, cardiac electrophysiology is actually a very highly specialized area of cardiology which actually deals with the electrical activity of the heart. For example, cardiac rhythm, we have a natural cardiac rhythm. So it's an area which completely focuses on the cardiac rhythm and its disorders.
So what are the common symptoms of arrhythmia and what should be the preliminary steps to be taken for the patient?
Yeah, so good question. It's a very common question actually. Cardiac arrhythmias, like I said, cardiac rhythm is basically generated by a normal electrical circuit. For the lack of a better word, I am using this word electrical circuit. So all our hearts, human beings, in fact, all living beings have an electrical rhythm which is generated by a very beautiful, sophisticated electrical system within the heart. Now, normally we don't have a normal heart rate. We have a certain heart rate range, and that's beautifully orchestrated by this electrical circuit. Now, whenever the hearts basically lose this kind of rhythm, or the electrical there is an electrical abnormality, or the heart is out of the control of this electrical system, that is cardiac arrhythmias. Now, the heart could be particularly fast or inappropriately fast, irregular, fast, slow. So all these rhythm abnormalities can cause minor to significant symptoms. Most common symptoms being that we come across as are abrupt palpitations, undue or disconcerting, unpleasant sensation of your own heartbeat, chest discomfort, of course, extreme shortness of breath, giddiness. Sometimes even patients come with frank blackouts, and the worst situations where there's a cardiac arrest and patients can actually potentially lose life. So it's a spectrum, but yeah, these are the common symptoms that we come across.
So who deals with these issues?
Again, like you said, cardiac electrophysiology is dealt with by a cardiac electrophysiologist. Now, I am an electrophysiologist, so primarily we are cardiologists. We are trained as cardiologists, and beyond cardiology, we undergo a more specialized training which focuses on cardiac rhythm abnormalities or rhythm disorders, and that's our area of so-called expertise, and that's why we are trained. So, a cardiac electrophysiologist is basically a cardiologist who deals with cardiac rhythm disorders.
So, doctor, what is the normal rate of the heart?
Yeah, I think I just touched upon it, Jasmine. The normal, there is no single rate which is called normal, say 60 or 70. It basically, there's a range. Now that range, for example, let's say somebody is asleep, in deep sleep, a heart rate of even 35 or 40 could be normal. Sometimes you feel, that sounds grossly abnormal, but that's true. Similarly, when somebody is taking a dash on treadmill, or there's an extreme physical activity, or for that matter a lot of there is an emotionally charged moment, there is a bit of argument or something, your heart rate can go up to even normally to up to 110, 120, in fact 140 also. So all this variability is brought about by the normal electrical system, the natural pacemaker that we have in our heart, and as long as it remains in that range and is actually regulated by that system, it is normal. So the answer to your question is, it's normally a range between say 50 to 100 beats per minute, but it can go beyond that also if need be.
So what are the potential consequences and complications of arrhythmia or heart functions?
Yeah, so arrhythmia is basically a broad disease. There are minor issues, just like any other disease. There are minor issues which can be nondescript, which may not be clinically even noticeable, but there are some rather devastating symptoms which can really cripple the patient. So apart from the symptoms that I just touched upon, There are some few things that viewers need to know. For example, atrial fibrillation, which is very common, and in fact now we are seeing a lot more atrial fibrillations in our day-to-day clinics. Atrial fibrillation is something that is a fast and an irregular rhythm that happens usually in the elderly age group. In such arrhythmias, patients can develop clots in the upper chambers because the upper chambers don't contract; they lose their mechanical activity. And in such situations, there is a potential of these clots coming out of the heart and going to the brain, which can cause a devastating stroke. Another situation is where, for example, when some young patients or other adults have heart attacks and they have enlarged and dysfunctional hearts. All these patients who have heart failure or enlarged hearts or previous heart attacks, they are prone to sudden bizarre cardiac standstill or a cardiac rhythm which can cause a sudden cardiac arrest. They can potentially lose their lives. That's a rather catastrophic complication of a heart attack. And finally, there is a situation where the same group of patients who have LV dysfunction or heart failure, they can have very irritating and stubborn chronic arrhythmias which are very stubborn. They just don't leave the patient. In such situation, the arrhythmia, which is actually a result of this structural heart disease, can come back and make the same structural heart disease worse. So it becomes a vicious cycle if we understand. And disease causes an arrhythmia, and the arrhythmia comes back to worsen the disease, and just the entire slope just downhill spirals and makes the patient worse. So these are a few things which can go wrong with arrhythmias and complications, apart from the symptoms that they can cause in day-to-day life.
So generally, what are the investigations necessary for arrhythmias?
Arrhythmias, it's an electrical topic, so it's the electrical rhythm of the heart. So naturally, the investigations are also electrical. So they all are they revolve or rotate around electrical rhythm documentation of the patient. Most common or the most simple tool all of us know about is the age-old ECG. Now, with modern advancements, I think many of our viewers are probably aware of Holters. And now we have these host of loop recorders, which are simple devices which are just attached to the patients, and they are capable of recording the rhythm of the patient. It's like an ongoing live ECG for days to weeks to even months. So essentially, there are some arrhythmias which are very rare and evanescent. They play hide and seek. They are difficult to document, and when you have a prolonged monitoring, you can actually kind of document these arrhythmias and can make the diagnosis or life of clinicians easier. Apart from the rhythm recording, there are some other tools like echo. Echo is also in fact an established tool which a lot of patients do get done on day-to-day clinics. And now we have cardiac MRI and other tools which actually look at the structure of the heart. Now the structure of the heart has a lot of association with cardiac rhythm, as we'll discuss further. Sometimes knowing the structure and the substrate that we're dealing with helps us in decision making and deciding what is the better course to take for the patient. Yeah, so in a nutshell, these are the few investigations that we resort to.
So are all age groups prone to rhythm problems, and what are the specific causes about them?
Yeah, so arrhythmias, if I understand the question right, do arrhythmias happen across the age groups? Yes, they do happen across age groups, but the cause is not the same. So no age group is spared or immune to arrhythmias. So, but they have different causes at different age groups. Starting from kids or infants, if you see many of them actually who have arrhythmias are born with some just pure electrical issues. Some of them can be mild issues, some of them can be really potentially fatal issues, and they generally have a genetic background. Again, another group of kids, although a small number, are born with, I'm sure people would have heard of structural heart disease, holes in the heart. They are born with structural defects in the heart, like holes in the heart or more complex diseases. Even when they get a timely surgical correction in their childhood, they still have a surgical scar to deal with in their hearts, and as they grow, these kids some of them tend to develop about 25 to 30% develop some stubborn arrhythmias, and can really cripple them and can make their growth and their quality of life go down. If you go a little at a little higher age group, adults and seniors, and then you have these heart failures, LV dysfunctions to deal with, hypertension causing hypertrophy or thickness of the heart, and then we are seeing a lot of obesity and sleep apnea. These things can cause a lot of atrial as well as ventricular arrhythmias. All these arrhythmias can cause significant symptoms impairing the quality of life, and can also cause serious arrhythmias which can cause sudden cardiac arrests also. In senior age group, especially elderly beyond 60, we see a lot of atrial fibrillation. I think I touched upon atrial fibrillation as to how it can predispose to strokes. That itself, stroke is a very important complication which has to be borne in mind when we deal with atrial fibrillation, and of course it can cause remarkable symptoms in certain vulnerable individuals. Then often we see a very specific age group, and working in Apollo for the last few years, we deal with a lot of patients who come from cardiac surgeons. Now valve replacement surgery is very common in Apollo and across India. Now these patients, especially who undergo valve replacement, they have chronic valve diseases, and they develop very sort of persistent stubborn arrhythmias, a large chunk of them, and these arrhythmias are really difficult to treat, and they are very stubborn, and that again is something that we commonly see. So there are different causes at different age groups. Some of them are purely electrical issues without any structural correlate. Some of them do have a structural reason for it, and if we deal with the structural disease of the heart, we can take care of the arrhythmia.
So what are the common causes of atrial fibrillation or irregular heart beating?
Yeah, great question. I think atrial fibrillation is something by the year we see an increasing incidence and prevalence in the society. Apart from increasing age, which is something which we can do nothing about, there are some factors which we can actually deal with, like hypertension, diabetes, obesity, as I touched upon, is something which is again remarkably increasing, and unfortunately the people are really aware of their numbers, their blood pressures, but no one really wants to look at their number of kilos that they have. So I think if we look at the numbers, we need to look at the right numbers, so that which is weight gain. Again, heart attacks, heart failures, enlarged structurally dysfunctional or mechanically dysfunctional heart, all these are risk factors. Thyroid problems, valve disorders like I just suggested, all these are important risk factors for atrial fibrillation, and increase the intensity of such episodes.
So what can we do to prevent irregularity of heart beating?
Well, like I said, certain things are just, if somebody is born with disadvantageous genes, they are born with an electrical problem, genetic issue, you can do nothing about it. There are some purely electrical arrhythmias which have nothing to do with cardiac structural abnormality. They have a beautiful, healthy lifestyle. These situations you can't do much, but there's a sizable proportion of patients who have cardiac arrhythmias coming out of acquired disorders. When I say acquired, these are modern, they have to do with modern affluent lifestyle, like weight gain, uncontrolled hypertension, poor sleep habits, awkward habits like working in the night, sleeping in the day, addictions, heart attacks, overweight. All these things can be eminently managed, to a large extent prevented, and therefore the arrhythmias which secondarily arise out of these conditions can as well be prevented. So a significant chunk of arrhythmias can actually be prevented or definitely mitigated by having a good proactive lifestyle.
So coming towards the next question, what are EPS and RF ablation, and how and to whom is this technology useful?
Yeah, so EPS, if you expand EPS is electrophysiology study, so it's understandably a tool that an electrophysiologist has. RF ablation is radio frequency ablation. Now EPS is basically an advanced, very sophisticated procedure wherein we as electrophysiologists enter the body. In fact, we enter the heart of the patient to actually interfere actively with the arrhythmia circuit, which has probably not been managed well with medicines, or the patient is still symptomatic. Now in such situations, I'm sure people would have heard of angioplasties or angiographies, where doctors or interventional cardiologists enter the body through the vascular space. Now if I can just show you or demonstrate how an EP catheter looks, this is how an electrophysiology catheter looks. Now if people who are abreast with angioplasties and angiographies, now these catheters, these are very flexible and soft wires, and if you can see at the tip there are some metallic ends. These are used, so we use these catheters to enter the patient's heart, and the way we enter is through the blood vessel, through the groin here, or sometimes from the neck. So these blood vessels give us, we are not interested in the blood vessels, we are interested in reaching the patient's heart. Now there are two ways we can reach a heart, either through an open heart surgery or through the vascular space which naturally goes into the heart. So once we are into the heart of the patient, we can use these catheters to record the electrical signals from the patient's heart, and thereby completely map the electrical system and that sort of enables us to create map and precisely define the arrhythmia circuits. Once we know the arrhythmia circuits precisely, we can target some critical areas through these specific catheters and deliver some energy by RF ablation. Now RF is radio frequency. Now ladies use microwaves in their kitchen, that's basically RF, radio frequency. Now the energy that we use is a very small fraction of it, is minuscule, but it is delivered through the tip of this catheter. You can notice how small this tip is, and it is delivered at a very focal point inside the heart, the size of probably half the size of the bindi that ladies wear, and that can probably potentially completely eliminate the arrhythmia circuit and can cure the patient of a very devastating arrhythmia. So this is about electrophysiology study, radio frequency ablation. This is something that we do on a routine basis. Sometimes it's a simple procedure, sometimes it's a very complex and a sophisticated procedure. This helps. Yeah.
So how much does it usually cost?
The cost again depends. It varies between 1.52 lakhs to up to 3 to 3.5 lakhs. It all depends on how complex the arrhythmia is and the setup for it. I mean, if you use a lot of catheters like this, or an additional 3-dimensional electrophysiology setup, then the cost goes up. But that again is not necessary for all cases. There are some arrhythmias which are very simple and then can be easily managed with a very basic setup. So it basically cost depends, like I said, on the underlying cause and the arrhythmia.
So are there any complications after ablation, and how effective are they?
Yeah, good question. Now RF ablations as such, generally if you talk of overall the EP studies, they are quite safe if you talk the entirety, but then there are some arrhythmias, especially in people who are rather sick and enlarged hearts and arrhythmias which have riskier arrhythmias, they tend to have a little more complication number, but overall if you see, the complications don't exceed more than 1 to 2%, which is a good number. Most of the time the complications are manageable and are minor, but sometimes we have serious issues. So yeah, effective and rather safe, but yeah, in some situations we do have complications, but not more than 1 to 2%.
Who are the candidates for ICD, CRTD or super pacemakers?
Yeah, so if we take it one by one, ICD, again we need to the expansion of ICD, implantable cardioverter defibrillator. So essentially it's basically a defibrillator or a lifesaver, as they say. Defibrillator, people who are candidates for defibrillator are young individuals or individuals who have had heart attacks, heart failure, enlarged hearts, dysfunctional hearts, because all of these people are at a certain risk of having a bizarre cardiac standstill. Now it's called sudden cardiac arrest. That's because of a complex electrical event that happens in the heart, which causes a complete cardiac stoppage. Now that's a really threatening situation and can potentially kill somebody. The highest risk of that group is again people who have these problems and have already had a cardiac arrest. So one of these events has already happened, so it puts them immediately at a higher risk of another event like this. So they are implanted with ICDs, and ICDs are basically devices which are implanted. I'll again show you some. They are implanted in the subclavicular area here under the skin, and they have a lead inside the heart. So they are essentially the sentinels of the heart. All the time the patient is normal, the ICD just remains quiet, but the moment they have an event like this, a threatening cardiac arrest, the ICD senses the event, and then within 30 seconds it swings into action by intervening and saving the patient's life by restoring normal rhythm. Talking about CRTs, now CRTs, and in recent times we are doing a lot of left bundle pacing, which is a very intuitive and a state-of-the-art technology. Now CRT and left bundle pacings are actually done in patients of heart failure again, who have severe mechanical dysfunction, repeated admissions with heart failure, who are still struggling with medical treatment. Now not all of them are candidates for CRT or left bundle pacing, but some of them who have a certain electrical delay in their heart are great candidates for such devices. When selection is right and is rather executed well, then we get a very gratifying result. The heart function starts improving, patient symptoms get mitigated to a large extent, and we can actually contribute significantly to their quality of life. But like I said, again, the patient has to be rightly chosen and executed all right. And the top of the tree lies the CRT-D, which is basically a very sophisticated device. It's a combination of CRT, cardiac resynchronization therapy, plus the ICD. I think we just discussed about ICD. It's a combination. It's a single device which combines the properties of a CRT as well as an ICD, and that has both. So it is anti-heart failure. It improves the heart function. At the same time, it mitigates the risk of sudden cardiac arrest in vulnerable patients. So these are a few devices that we implant. So they are called cardiac electrical devices. I'll show you a few if you can. So this is basically, if our viewers can see, this is a routine pacemaker. If I don't know whether it's seen. Is it seen? Yeah. So this is a routine pacemaker. I can put it on my chest for their understanding as to how big the pacemaker is, and the thickness is about this much, about 2 to 3 millimeters, and it is implanted in this area below the clavicle in the subcutaneous tissue. So we have skin, we have the fat below the skin, and we go just below the fat on the muscle and implant this device here. And then if you notice here, there are leads like this. Now these leads are connected to these devices like this. So these devices control the cardiac rhythm, or at least regulate the cardiac rhythm in the necessary patients. And these leads basically are implanted into the heart, and they travel through the veins inside the heart, and they are positioned, secured inside the heart, and this device is here in this subcutaneous area below the skin. And this is a very elegant device, and nothing is seen outside, and quite regularly done in all the hospitals. If you talk of ICDs, this is an ICD. So we have, this is a device, this is slightly bigger if you compare to the pacemaker. This is a bigger device. If you see the footprint of this device, this is a bigger device, and because it has got a bit better responsibility, or a more larger responsibility, it has a bigger circuit and all that. So it's a more imposing device, but again it is implanted here, and similarly, just like the pacemaker, the lead of this device goes into the heart. Now if you talk of CRTDs, it's again a similar device. It's also a little big device. So these are kind of electronic device that we implant in the patient's body to get the necessary response.
So coming towards our audience questions, so when should be one worried about an irregular heartbeat?
I would say don't be worried about it, but try your best to prevent it. So just like heart attacks, you need, there's no point worrying about heart attack, but do your best to not think about it, but still do your best to prevent it. So have a good lifestyle. Now these are all cliche things, these are all theoretical. These are not theoretical, these are things that even matter even today, and probably matter the most. So have a critical outlook at your blood pressure, see how well it is controlled. 140/90 is actually not as good as 120/80. So I mean I have seen many times patients say my blood pressure is fine, I'm probably 150/90. No, you're not. You still have a scope to come down to lower the better, 120/80. So have a critical understanding of blood pressure. Be very, have a target of weight. Weight is something people are very relaxed about. If you have a certain weight, your overweight is now we're understanding more and more. It's a central. It plays a central role in many diseases. So have your weight under control. Have a good religious diet. I'm not saying don't try a cake or something now and then, but overall see what you're eating. Have a good diet and a good diligent diet plan. Be proactive in your lifestyle. Take at least half an hour to 45 minutes, if not every day, at least 4 to 5 days in a week. Try to do something which is physically engaging, and that will keep you in a good state. Good diabetes control is extremely important. Patients who have diabetes, it goes well beyond heart. It goes to the vascular system, stroke, it goes to the kidney care, it goes to retina care and whatnot. Stay away from addiction. Sleep well. Have a good sleep hygiene. Awkward sleep habits. All these things don't help. Again, people who have gross obesity, they have a problem called sleep apnea. I think through your platform I would like to talk about it. Many people, when I talk of sleep apnea, in fact we talk about sleep apnea, they look at us. Sleep apnea is basically, it manifests to you as snoring. So the habit of snoring, and there is an excessive daytime sleepiness. When I bring it about, people say, no, we are here for a complex problem of arrhythmia, and you're talking about snoring. Well, that is, if you are snoring, if you are snoring in the night, it means that your respiratory passages are obstructed. You are self-obstructing. That causes hypoxia, drop of oxygen levels in your body in the night time, and that is happening every single night probably for the last few years, and that hypoxia is cumulative and causes a lot of ill effects on critical organs like brain and heart, and that eventually what you see as arrhythmias is a result of cumulative hammering of low oxygen levels for many years. So take care of the elementary risk factors, and I'm sure you can prevent or at least delay the diseases, not only arrhythmias, many diseases towards, you can push them later.
So what foods should one avoid if they have arrhythmia?
There is no food as such that one would, I mean, generally the food habits which are good hold good for arrhythmias also. If you have raw, unprocessed food, you always go by that. So things which, low carb, good balanced diet is always good for the body. More important than what you are eating is what you are spending. I think if you maintain your body weight in the expected range or the healthy range, and you're being physically active, you can be a little forgiving about what you take in terms of food. But at the end of it, if you talk about a little bit of raw, unprocessed food with good quality carbs and proteins and a good balanced diet should do you well.
So what is the difference between heart palpitations and arrhythmia?
Well, they may be connected. Palpitations is actually a symptom. For example, what is the question is analogous to what is the relationship between fever and pneumonia? Well, fever is a symptom, and symptom could be because of pneumonia, but then it could be because of dengue also, it could be because of COVID also. Similarly, palpitations is a symptom which happens in cardiac arrhythmias where the heart beating is not normal, it is gone into an abnormal rhythm. But palpitation can also happen in non-arrhythmic problems like anemia, like thyroid issues, like heart failure, or even sleeplessness, sleep apnea. So many things can cause palpitation, but palpitation is a symptom which can be a pointer of cardiac arrhythmia.
So can one live a long life with irregular heartbeat?
Yes, why not? Irregular heartbeat, I mean, if there is an atrial fibrillation that you are thinking about, atrial fibrillation patients can still live a long life given they are managed well pharmacologically, given they have a good lifestyle. Often what matters is not only the arrhythmia. If you have comorbid illnesses, you may have two people with the same arrhythmia, but somebody with a very sick heart, with poor kidneys, the heart function is not great, and you have a lot of other illnesses to contend with. There the longevity, not only the longevity, the lifespan, the quality of life, also all of them are compromised. But if you have an isolated arrhythmia and the other parameters are all good, your body functions are good, your cardiac function is good, your lifestyle is good, then I'm sure the arrhythmia can be managed well, and there are a lot of patients who are doing well with and arrhythmias being managed well. Actually, that helps when you have other things balanced, then that helps in managing the arrhythmia much better.
So why is arrhythmia worst at night?
I don't think it's worse. Is somebody asking why arrhythmia happen in the night? Arrhythmias, I don't think it happens across. It may happen anytime. There is no relationship of an arrhythmia except barring one or two rare conditions. Arrhythmia can happen anytime. In fact, most of the arrhythmias actually happen during daytime when the person is physically active and agile. Sleep is actually a rather passive state where arrhythmias tend not to happen. But yes, there are some exceptions. There are some arrhythmias which do happen in the night.
Are heart rhythm issues fatal?
Some of them, yes. That's fortunately that's a minority, but yes, for some arrhythmias can be devastatingly threatening. We have seen patients, and we have really had tragic stories where the first symptom was the last symptom. But sometimes they can be forgiving. Most of the times they are forgiving. But yes, there are some arrhythmias. I think I've alluded to. Most of the situation that we see these days is heart attack associated cardiac arrhythmias where they have sudden cardiac arrests. They can be fatal. There are some familial or congenital or inherent genetic problems which can be devastating. Sometimes they have poor family history and they can lose their lives at a young age. So yeah, there are some arrhythmias which can have serious consequences, but it's a very small number.
Can heart rhythm issues be cured?
Oh yes, they can be cured, they can be prevented, they can be managed. So we look at overall, so there are sometimes we look at complete cure. When it's possible, we completely eliminate it either through medical treatment or through interventional management, like I just said. But sometimes when it's not possible, we try to preserve the quality of life by trying to mitigate the symptoms and trying to manage the collaterals, or trying to manage the other organ systems, managing the blood pressure, managing the patient's hemoglobin, managing the patient's overall quality of life, rehabilitating them. So yeah, most of the times we can manage, we can work our way around it.
So generally, what are the medications which are used to treat heart rhythm problems?
Well, there are few medicines that we have in our armamentarium these days. Just like interventional treatment, even medical treatment is advancing. So, like I said, arrhythmias is not in isolation. Arrhythmia always has, most of the time, has a structural association with the heart. There is a structural problem as well. So, when we manage the problems which are parallel to the arrhythmia, so if there is somebody who has heart failure, if heart failure is managed well, the arrhythmias which are related to heart failure are not going to arise, or at least can be eminently manageable. So, there are some specific medicines which we always give for cardiac arrhythmias, and there is a little bit of overlap between these medicines which are used for arrhythmias and the same medicines are also used for heart failure and other conditions. So, yeah, there are some medicines which we do use.
So coming towards the last question, Doctor, could you please tell our audience about the facilities provided at Apollo Hospital, Jubilee Hills, Hyderabad?
Oh, yeah, phenomenal. I mean, I'm so proud, I'm so happy to be a part of this platform. Needless to say, it's a state-of-art institution. They are very pro technology, they are pro evidence, they back, whatever helps the patient. It may not necessarily be an intervention or a surgery or something. Whatever helps the patient and improves the patient outcomes is backed and fully backed by the hospital, and the hospital is so well staffed. The faculty, the colleagues, the paramedical staff, the equipments that we deal with, they're always there, up there, and they want to keep updating the system and want to be owning the state-of-art equipments. And I'm really proud to be a part of this platform. I'm thankful for this really opportunity.
So dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Soumen Devidutta and clarify your doubts. Thank you, Doctor, for educating our audience
My
in
pleasure.
today's session.
Thank you. My pleasure.
Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.